Coming up next, I talked with one of South Florida's top plastic surgeons, Dr. Daniel Mann. And in an interview taped earlier, I asked Dr. Mann how long he'd been in practice.
30 years.
Wow, that's terrific.
I love it.
Well, you came from Israel, right?
Yes.
Where did you study over there? Or
Yeah,
over
I did graduate Tel Aviv University, and then I finished residency here and in Boca Raton since.
Plastic, are you finding more men getting involved with plastic surgery now? Rather, it used to be just primarily women, but now I think
more and more men are coming into it. They think the same like women, and they just marching behind. Used to be 10%, it's up to about 20%.
I'll be darned.
Yeah.
Well, that's pretty. Well.
And why not?
Yeah, why not? Because the most. Well, listen, while we're talking about men can you fix this turkey neck of mine? That thing.
Yeah, if it depends on the situation. If it's a healthy person who doesn't have much medication on board, we do a neck lift, which is called an open neck lift, and that's a simple, fairly good procedure, and it gives wonderful results for these lifts.
Yeah.
But if the patient is on blood thinners,
yeah,
then we need to look at different options. If they can stop the blood thinner, that's good. Then we can do the open neck lift. If not, we can do some radiofrequency. There's a wonderful new technology of tightening the skin with radiofrequency.
With radio frequency?
Radiofrequency. Similar to the radio that you listen to, but
yeah,
different wavelength, and you get the molecules in the skin moving around. There's heat, collagen, and there's tightening effect, and the neck looks better, and it lasts.
Well, that's okay. Well, speaking of collagen, do you some of the women get involved with the lip collagen, and sometimes it looks rather grotesque. How do you handle that?
Well, first of all, collagen has been many years ago, and women used to come to the office, and it would last only 3 weeks. Can you believe they would come again for doing it 3 weeks later? But now we have material last years even. We can do what's called permalip, lip implants, and it's a short procedure under local anesthesia, and you can fill up the lip nicely with lip implants, silicone, and it feels just like the normal lips in smiling, talking, eating, kissing, no problem.
Oh, wow.
And they should not look bad, they should look good.
Yeah. Well, your patients, or I should say in the plastic surgery patients area, it's kind of a discretionary outlook or an outlay in money. How did you survive the recession when the money was tight?
Well, we were preparing to this period with many ways, improving the technology, doing some things that will give patients wonderful results, long-lasting, and with a really small amount of money compared to, and we were able to develop this technology, and now we have amazing improvements, and that's how we survived this.
Okay, so yeah, but you're getting new innovations, and it's where you're avoiding the expensive surgery, the cutting, right, and stuff like that, what it used to be.
Right, just like radiofrequency for skin tightening, yeah, of the neck, we can do now innovative skin rejuvenation for the surface of the skin. It looks amazing in 2 weeks with no time, just applying some special creams.
Well, can you do that with my turkey neck?
Well, the turkey neck would need the radiofrequency, but yeah, the skin of the face could be improved as well, and the patients look wonderful, but they don't have to pay thousands of dollars to do it.
Yeah. Well, when you had a nose lift, I've noticed this. Some of the women I've noticed, they go around for 2 or 3 weeks with black eyes and and a big thing, yeah, on their nose. Is that being avoided now?
We can avoid it. The nose is the center portion of the face, yeah, but that should not. Your eye shouldn't go into the nose as there's something different. It should be in harmony with the rest of the face. So black and blue certainly does not belong to a nose operation. You can cut down with a special method that we have when we do the open technique, and then the patients have hardly any black and blue after the operation, which is not painful as well.
Oh, well, that's terrific. With things that you're doing, yeah, and you've been doing this for 30 years, so you really know what's going on.
Yeah, we developed various kinds of improvement.
Doctor, not only do you practice plastic surgery, but you're also an artist and a sculptor. How did that come about?
I believe that having art is very important in what we do, because you can achieve technically okay result, when you do plastic surgery. But if you're an artist and you really know what you're doing, you get a result that is pleasing to the eye, and it's so
Yeah.
important. And I learned to become an artist on my own, and I took some steps to become better and better. And several years ago, I had a painting in the White House,
Wow.
hanging for 3 years during Clinton.
Yeah.
Yes. So outside the Oval Office, there's a painting of Danny Mann. Yes.
I'll be darned.
Yes.
Dr. Daniel Mann
Right.
in the White House.
Right.
That is terrific. You're also to do life-size sculpting.
Yes. I have a lot of sculptures that are walking around. These are patients.
Yeah, that's true. Yeah.
But
Yeah.
there's a lot more responsibility when you do with patients. But to do patients well, you need to know how the form goes. That's what it's called plastic surgery, form. And when your eye trains also on sculptures, actually the anatomy helps the sculptures to get better. The sculptures helps actually what you're doing with patients. You become better. And
Well, Dr. Mann, God bless you, and
thank
good
you.
luck with your painting and your sculpture, which is absolutely fantastic with what you're doing.
Thank you.
And you look, and boy, when you take care of my neck, you're going to have to look at it with the eye of a sculptor.
We have the technology.
Thanks a lot, Doc.
Thank you so much.
all right.
Thank you.
And stay with us. We'll return right after these words.